It's going to be quite an interesting discussion given the complexities of what was just shared and what many of you alluded to this morning in terms of all of the various ways you try to treat and manage your lupus. But we're going to do the best that we can, and I think there's going to be a lot of important information coming out of our conversation. To start it off again, we're going to start with some polling questions, if we can pull those up. That will explore some of these current approaches to treatment and some factors that you might be taken into account when looking for future treatment. So our first question for you is, have you ever used any of the following prescription medications to help treat your lupus? Check all that apply. And again, if you are a representative of a person with lupus, please answer for the person you are representing. So here, select all that apply. The options are A, prescription strength analgesics, B, antimalarials, C, aspirin, D, biologics, E, immunosuppressive medications, F, anti-inflammatory agents or NSAIDs, G, other prescription medications not mentioned, or H, you haven't used any of these medications. So please check all that apply. I'll give you about another minute to get in your responses. And there's a lot of options here. Prednisone, look to our committee, our planning committee with that. Where would we fit that? Which of these categories? Looking to, I don't see any of our reps from the groups. Nobody? Anti-inflammatories? Does that make sense? Probably. Or I'm hearing different things. Yeah. So, okay, so our anti-inflammatory agent category includes both steroid anti-inflammatories like prednisone as well as non-steroidal anti-inflammatories. Thank you for that clarifying question. So that would be, steroids would be F. Mm-hmm. Okay. So it looks like, based off the total number of responses, each of you submitted somewhere between 4 and 5 different categories or classes of products that you're using, given about the average number of respondents to each of the earlier questions. And so it looks like we've got quite a distribution of responses, the most used being anti-inflammatory agents or NSAIDs, or something else not listed. So it'd be very important to explore what other categories of products you're using that aren't listed. Kind of the next tier are anti-malarials and immunosuppressive medications. And then there seems to be fairly decent representation of use of prescription strength analgesics or painkillers, aspirin, and the biologics. Nobody reported that they haven't used any drug medication. So, next question. Okay, so here it's another select all that apply. Besides your drug therapies, what else are you doing to manage any symptoms you have experienced because of your lupus? So here the options are A, dietary and herbal supplements, B, diet modifications, C, over-the-counter medications, D, complementary or alternative therapies, E, other therapies not mentioned, or F, you are not doing or taking any therapies to treat symptoms. So please select all that apply. Give you a few more moments to submit your responses here. Okay, it looks like of these non-prescription drug therapies, the things that have been tried the most are diet modifications and OTC drugs. Close after that is dietary and herbal supplements, some complementary and alternative therapies, and then again, some therapies that were not mentioned, so we will explore that as well. It looks like about on average, there's been about 2 to 3 of these that each of you has tried. Next question. So when choosing a treatment, we'd like you to respond to what is most important to you, selecting one of these things. A, delaying or preventing symptoms. B, improving symptoms. C, increasing life expectancy. D, slowing down organ damage. Or E, other. So please select that which is most important to you when choosing a treatment. Give you a couple more moments to get in your responses. So it looks like over half of you, when choosing a treatment, it would be most important to improve symptoms. As somewhat distant seconds, it looks very close between delaying or preventing symptom progression or slowing down organ damage, with only about under 10% of you saying that you would look for an increase in life expectancy, and nobody said other. Next question. So our next question for you is one where you'll select your top 3 choices. And the question is, what are the biggest downsides of your current treatment? And so here your options are cost of treatment, B, how long it takes to get treatments, such as infusions, C, kidney dialysis, D, the number of pills or medications per day, E, side effects of the current treatments, F, the need to travel to a hospital or clinic to access current treatments, or G, something else related, some other downside of your current treatments. So please select your top 3. So as some of the final results trickle in, it looks like our top response, seemingly very in line with what everyone has been saying so far, is side effects of current treatments are the biggest downside of them. A close second is just the total burden of the number of pills and medications that are required per day. And number 3 is the cost of treatment. A number of you also selected how long it takes to get the treatment, as well as needing to travel to a hospital or clinic. Another smaller amount of you said there was something else. Nobody mentioned kidney dialysis. Next question. So here we're going to ask you to select your top 3 factors that you take into account when making decisions about a treatment plan. And so there's a number of things here, so I'll read through them. I'll let you mull them over. First, A, how closely it needs to be checked by blood tests. B, how it will impact your ability to get through the work or school day. C, how much it costs and how much you will have to pay for it. D, how it will change your appearance. Examples of this could include weight gain, weight loss, acne, or hair loss. E, how it will impact your ability to spend time with your friends and family. F, if it will put you at risk for cancer in the future. G, likelihood that it will work. H, what your doctor thinks about it. And I, another factor that's not listed. So please select your top 3 factors that you would take into account when you make a decision about choosing a treatment plan. It looks like we're getting close to finishing getting the results in. So the top factors that you say that you take into account when making decisions about choosing a treatment plan, the top factors are the likelihood that it would work and the how it might impact your ability to get through the work or school day. After that, you take into account if it will change your appearance, and then a number of other factors are closely weighted in similarly about number 4 in your priorities, which is how much it will cost, how it will impact your ability to spend time with friends and family, if it will put you at risk for cancer in the future, and what your doctor thinks. A couple of you also mentioned factors not listed. And our final polling question, please. So our last question for you is, assuming that there is no complete cure for lupus, what would be the most important result that a treatment could provide? A, I feel better and can go about my daily life more easily. B, I have fewer long-term health problems like organ damage. C, you have a longer life expectancy. D, my overall treatment plan is easier, so it would maybe include fewer medications or fewer visits to a hospital or clinic. And E, your overall treatment plan costs less. So please select, short of a cure, the top thing that would be important as a result of a treatment. Okay, so it looks like by a large margin that the top thing you're looking for from a future treatment, short of a cure, would be to be able to feel better and go about your daily life more easily. After that, you're about a quarter of you are looking for fewer long-term health problems like organ damage. A little bit under 10% of you would like to have would want a longer life expectancy. It looks like maybe one person said overall treatment plan being easier, and no one mentioned your top priority being the treatment plan costs less. So thank you all for participating in the polling. If we can switch back over to the main slide deck. All right. So now is our chance to continue our conversation from this morning and begin to explore some of these new issues related to your current approaches to treating lupus. Let's make sure it's on. So here we want to explore with you the things that you've tried. We've included many of them in the polling questions. Certainly our panel discussed a lot of both lupus-specific as well as non-specific treatment approaches. And so what we're interested in hearing from you are your experiences with those approaches to treatment, whether that be a prescription drug, an over-the-counter drug, something else like diet. I know we heard from our panel that dance and exercise could be important. We heard this morning the importance of maybe napping. So, really anything in the universe that you might do to try to manage your symptoms is within the scope of what we're talking about here. And so when you raise your hand and share, what I'm interested in hearing is whatever treatments you think are important for us to hear about. How well has it worked, or maybe not worked for you? Is it something that you're currently using, or is this something you're talking about that you used in the past, whether it be successful or unsuccessful? And then, along with the context of how well it's worked, have there been any downsides related to it? Many of the things we've talked about certainly have side effects or other burdens. If it's something that you're still taking, by sharing with us how well it's worked, we can understand your individual benefit risk assessment of that product and the fact that you're still taking it despite those side effects. And then if it's something that you've discontinued using, again, the fact of maybe it did work, but the side effects were too great, or maybe it didn't work, so the side effects just weren't worth it. So we want to kind of explore not just what it is you've taken, but really explore your personal decision-making related to those products. Help us understand why you took it in the first place, how well it worked, and what the downsides were. And again, we're interested in hearing both what are commonalities within the community and maybe what are some different experiences than what we've already heard about. We'll start very broadly. If anyone has a really unique or important experience, we want to hear about these issues from you. Yep. If we can get, where are our mic runners? Okay. We'll start here in the front center with Elizabeth.
Hi, my name's Elizabeth Beck. You heard me on the panel, so I don't need to go any further. But one of the things that really impacted me, well, I don't do it anymore, but Cytoxin or chemotherapy, I had a really hard time with it. It definitely helped with a lot of my symptoms, but it had a lot of downsides to it, especially since I had a condition called wasabi nose that not a lot of people get. Even my doctor didn't know about it until she went to a panel meeting. So basically, during your treatment, it feels like somebody stuffed wasabi up your nose. So you spend the whole treatment, if it's not treated, basically wanting to scream in agony. So my chemo treatments would usually take 6 hours normally, but since my wasabi nose, there was no medication you could take or thing that would make it stop. So I would spend 12 or more hours with this just to get the pain to be acceptable. So 12 hours of constant pain in your nose, and then the next day feeling nauseous just from the treatment. It helped, but there were just so many downsides that I just wondered, I know it's worth doing, but it just hurts so much. I was actually wondering if any of you guys actually went through that. Oh, okay, fine.
Oh, yeah. Elizabeth, could you tell us a little bit? You said that you did get benefit from it. What were the symptoms that it most benefited for you?
I definitely felt a lot better with everything that was going on in my body. It just made me feel like not. I felt bad because of the pain and everything, but it definitely lessened a lot of the pains that were going on in my body. I still had joint pain, I still had stomach pain, I still had fatigue, but I didn't feel like inside my body was just messed up.
Thank you. Thank you for sharing that, Elizabeth. We'll come around the table.
I realize you were like right next to me. Hi, my name is Audrey Egala. I'm 28 years old, and I've been officially diagnosed with lupus for 2 years. I've probably battled it for about 6 prior to that, with things all the way from broken legs to low platelets, and finally having a stroke in 2015, which we discovered lesions in my brain. And so the first year of treatment consisted of your standard forms of therapy, of course, Plaquenil, steroids, antimalarials, organ rejection drugs. I did end up going on Benlysta, and I loved Benlysta for myself, frankly. It did give me energy, and that was the biggest thing, right? We all hear about the fatigue. It improved my fatigue, and my daily living was significantly improved. I'm a personal trainer, and it allowed me to pursue my passion. And so with that being said, however, in August of last year, wow, brain fog is like kicking in really hard right now. August of last year, I suffered temporary paralysis in my legs and in my arms, and I wasn't able to walk for hours out of a day or move my arms. So we, at that point, had to get off of Benlysta because I had CNS involvement. I have neuropsychiatric lupus and PSLE. And due to requirements and criteria, if you have that type of involvement, you're no longer really eligible criteria-wise for Benlysta. So my doctor at that time recommended that I take Cytoxin therapy for 7 months. You asked about what risks do we have to look at when making the decision to take a medication like Cytoxin. And as you mentioned, it does a number on you. I feel for everyone that has lupus in general, but Cytoxin therapy is just something all on its own. But you know what? It was something that I had to weigh the risks with, and at that point in my life, I already have 2 children. I'm blessed with that, and so I made the decision to pursue it because my doctor felt that it would prevent permanent paralysis. That if we could stop it, now I have permanent nerve damage on my left side. My left side is significantly weaker than my right. However, once I completed the 7 months, I was very hopeful, and I'll never forget the day that I went in and completed my last treatment. He then said, we have to now go ahead and pursue Rituxan because it didn't necessarily put you where we need you to be, and your lupus is very, very active. So I pursued Rituxan, and again, it's off-label. I was denied due to requirements again, listing that I had involvement with, my primary involvement, again, is my brain or central nervous system issues. And so fought that and was able to get Rituxan. Started my first treatment and had issues now with my ovaries because of the Cytoxin. And I wanted to just touch base on one thing. A lot of these women, as you know, were mostly in childbearing years, and I feel greatly for them. I just wanted to mention that there's another perspective to it, and because of the Cytoxin treatments and the Rituxan and the prednisone and the Plaquenil and everything else that we've taken and cell-sipped, I actually discovered that I was pregnant, and I am 3.5 months pregnant now. Thank you. I just wanted to quickly touch base on a different perspective that I wasn't exposed to until this pregnancy, is the lasting effects of what it could do to an unborn baby. And when you're told that you can no longer have children, I cannot imagine that to the women out there that don't have children. I understand that I'm blessed. I understand that. But there is another aspect to it, and being told that your doctor's first statement is, I'm sorry, you're pregnant. You can terminate your pregnancy due to potential defects in your fetus, or your child may be what they call incompatible with life. So as far as weighing risks and things like that, I guess it wasn't brought into my perspective until I found out I was pregnant. Now I have a huge passion for finding a drug that we don't have to consider those risks and those unfortunate circumstances like that. Yeah. So, but yes, and so now my regimen is not working. I have kidney involvement because I'm pregnant. I had to cease basically the majority of my medications and start back from step 1, which is just Plaquenil and prednisone, which currently I feel is like a Band-Aid to a bullet wound. And basically we're just waiting, I feel. Yeah. Instead of being preventative, we're going to be reactive, and that's honestly the plan of action. So I wanted to share that as far as treatment options, it has an effect on your body, yes, and now I'm aware that it has an effect on an unborn child. At this time now, you place yourself in a different role, and you have to consider, if you do get sick, if I have another episode of paralysis, am I going to take the chemotherapy to prevent permanent paralysis and risk my child's life? There's just so many things that I never considered until now. So I did want to shed light on that perspective.
Oh, thank you. Very important and very probably unique. We'll come over, work our way here.
Hello, my name is Devin. I come from New York, and I just wanted to add on to yours. I am a lupus patient, and I had gotten pregnant, and I had to get dialysis throughout my whole pregnancy, 6 days a week. And now I've had my baby girl. She's 2 years old now, and she's perfectly fine. Nothing's wrong with her, so good luck to you in the future. What I wanted to talk about was now I do have to take hemodialysis 3 days a week. And I found like the downsides are like I get migraines, I get nauseous sometimes, I sleep throughout the day. And for some reason, like the only time I'm actually awake is at night. But then there are some days where I actually feel really good after dialysis, which is rare, but it gives me energy to go on for like maybe 24 hours.
Yeah, thank you for sharing that. Yeah. Go right ahead.
Hello, everyone. My name is Amber Brewer, and I'm from Maryland. I'm probably one of the only people in this room who will admit that I actually like prednisone. Personally, for me, it does wonders when I start to wean off of prednisone. I tend to flare. When I'm on high doses, I seem to be fine. Recently, my lupus attacked my peripheral nervous system, so I've had IVIG infusions for about 9 months, and I stopped those because of a case of meningitis. But a thing that I'm trying and that I wanted to share with you all, and I don't have any results, I don't know what'll happen, but I recently was talking with my mom, my boyfriend, and my wellness coach about changing my mindset. I tell myself every year that my lupus flares in the winter. I tell myself every year that the winter is the worst time for me. So I'm trying to change my mindset by journaling. Every day I write in my journal saying that lupus will not get me this winter. I am stronger than the winter, and I will survive the winter without a flare. So just something I'm trying that I thought I'd share with you all. Thank you.
Yeah, thank you. Hopefully someone will have an experience with that and might give you some insight. So we'll go right next door here.
Hi, I'm Amanda. I'm 26 from Wisconsin. I was diagnosed June 2010. So I guess for me now, I'm on Plaquenil, and then subcutaneous methotrexate, and then diclofenac as needed for pain. And I guess for me, my biggest frustration when it comes to my treatment is the extreme dichotomy between my good days and my bad days. So my good days, I expect a lot out of myself. I hold a really demanding career. I travel a lot, I backpack a lot. I'm a competitive weightlifter. So I do that every day and I expect myself to perform at a high level. And then literally the next day, my boyfriend will find me in the fetal position on the floor because I can't open a drawer to get something out to try to put on. And then he has to sit in the bathroom with me for 20 minutes while I attempt to brush my teeth. And he may have to pick the toothbrush off the floor for me because I can't bend over to do that. So my problem is that I don't have any adequate intervention for those bad days. So, you know, I can have a string of good days where I think my maintenance medications are doing their job and, you know, maybe I'm in remission or maybe I made all this up. And then I can go a string of, I'm going on 12 weeks now of a flare that no increase in my medication will fix. I refuse to take prednisone long term anymore because of what it's done to me in the past and how it affects my quality of life. And aside from just maxing out on my pain meds, which barely make a dent on my bad days, there's nothing I can do, and that's extremely frustrating. So the only thing that I can do is wait it out. And I think about being an ambitious 26-year-old woman, like how much time I've given up just wasting time, just waiting it out. That's extremely frustrating.
And how have your regimen, your maintenance regimen, I guess is how you described it, over time, has that stayed pretty steady, and has your, as a consequence, your number of flares or severity of flares been pretty consistent over time? Is there any relationship with your maintenance regimen?
Yes. So I do a lot with obviously exercise and then my diet. Like I've been able to control things pretty well with that. And as a result, actually, a few years ago, I completely tapered myself off of prednisone and then tapered myself off of methotrexate as well. And so I went a pretty long stretch where I was just on Plaquenil. And that's when I thought maybe I had made it all up because I felt so good for so long. And then I got sick actually on a cruise. I got a virus on a cruise, and then it was like all downhill from there. And it kind of never got back to baseline yet. And no matter how much I increase meds or whatever, it's just, I'll have a good day and I'm like, oh, okay, we're on the upswing. And then all of a sudden I'm kind of hitting rock bottom again. So, but yeah, I do think that diet and exercise did play a huge role when I was able to get off some of them. But I think at some point you're just trying to play catch up and you never will.
Right. Okay. Thank you very much. I'm going to work my way over here. We'll go right in the center.
Hello, my name is Shunya Anding, and I've had lupus for 23 years. I'm a big believer in Western medicine combined with complementary medicine, our treatments. I have taken prednisone and Cellcept and Plaquenil, and for serious things like pericarditis and brain inflammation. But consequently, I have osteoporosis, and I've had 2 hip replacements. And so I have to say, the thing that helps me the most is rest and meditation. And it sounds easy, rest, but it's a very difficult decision. It changes your relationship to your job. I had to leave my profession, and I now am a wellness coach, so I have a good alternative. But it changes your relationship to your husband, your friends. I don't have children. But it does help me live more days being a healthy person, having less stress. And I've learned that less stress also includes eating regularly on a regular schedule, taking a nap every afternoon, getting enough exercise, just keeping my schedule regular. So, and then diet plays a lot into it too.
So when you say rest, describe that to us. What do you mean by that?
Well, it's very specific, actually. I lie down on my back. I make sure that all my joints are perfectly aligned. My first 2 years with lupus, I was curled in the fetal position, and my shoulder and my hip have suffered from that. So I make sure all my joints are aligned, including my fingers. And I imagine, and then it happens, I can feel the energy in my body, and I can feel that energy circulating in my body and replenishing and healing. And I'm convinced that this really, really helps me.
Great. Thank you very much. Can you kind of rotate around?
So I know, like many of us, we probably answered all of the above to a lot of those medications and groups of medications that were being offered. I think for me, through the constant has been prednisone.
Your name?
Lindsay Wisham, I'm from
Lindsay.
Iowa.
Hi, Lindsay.
I think the constant has been prednisone, and I think the difficult part of that is that my threshold of the level of prednisone that I need to keep as a maintenance dose throughout has increased year over year. I've had lupus for 20 years. And I call it my gateway autoimmune disease, as maybe some of you can relate to, is that we deal with other conditions. So in regards to that, I was diagnosed with Crohn's disease 5 years ago. So a lot of times I have to take into consideration multiple diseases, multiple symptoms when choosing a drug or a treatment plan best for my lupus.
Yeah. Great, thank you. All right, we'll come here, and then I want to make sure I hit up the left side of the room here, my left.
Thank you. I'm Tiffany Osbury, again, sorry. I don't feel like anyone else has stated this. When I first was diagnosed, I went on prednisone, and it just made me really sick. The symptoms were better, but then also I had tons of other symptoms. So I went on Plaquenil. And my nausea was so bad, I was vomiting almost daily, as I stated earlier. So then, try something new. I went on methotrexate pills. Methotrexate pills made me so sick. My stomach was always hurting. I was recently diagnosed with IBS and had no problems of that before I took methotrexate. Started something new, did methotrexate injections. My insurance wouldn't approve anything else. Methotrexate injections still made me so nauseous. And I don't feel like anyone else has stated that they have had such bad nausea problems. And maybe that comes because I have myositis in multiple ways, and that my esophagus is weakening kind of. But the nausea is my biggest problem. I just started Rituxan 4 weeks ago, and after my first infusion, they literally thought I had this most severe flu ever. My symptoms were so bad. I had vomiting. I had severe, more severe fatigue than you could ever imagine having lupus. Then I had fevers and just flu-like symptoms so bad. After my second injection or infusion, I didn't really have such as bad problems, and so I'm really hoping to see that I don't experience these symptoms over my next 6 months. But I didn't know if anyone else had the severe nausea problems, or if they ever improved.
There's a lot of nodding heads on this side of the room, so
I didn't
you're not
know
alone.
if that was just me.
Yeah. All right, can you get a mic here? And
Hello, everyone. My name is Carlene Harrison, originally from Brooklyn, New York, but currently living in Richmond, Virginia. I was diagnosed with lupus in 2011. Of course, like many of you, suffered symptoms for years prior. My lupus decided to go hard or go home. I have SLE as we know it. I have lupus profundus and paniculitis, tumid lupus. I have nephritis. I also have discoid and cutaneous like many of you. And so lupus has really done a big number on me. I also have Raynaud's and recently found out that I have a aneurysm. So it's been a whirlwind. When it comes to treatment, though, I'll speak on two of the medications that we've mentioned frequently today, prednisone and Cytoxan. Prednisone for me was a blessing and a curse. It was a blessing because it did help with the inflammatory issues, and that helps you with your quality of life. However, it has been a curse otherwise. I have, of course, dealt with the insomnia, the eating, and that midnight snack turns into a midnight meal and that type of thing. But also it's worked a number on my teeth. Within the last year and a half, I had to have 21 teeth removed, and I'm 31. That's not supposed to be a thing. So that then affects my quality of life far beyond just being a patient, being a student, being an employee, because, in a perfect world, this presentation, the physical, is not supposed to be too important. But when you're on an interview, and you have to deal with other people for your job, you can become a liability. And so I, may not get hired because of things like that. And I have experienced that. I did have to stop working. I was working in a laboratory, human genetics. I had to stop doing that. I had to take myself and begin working from home. But recently, due to the aneurysm and the headaches that accompany it, I was let go from my most recent position. And so that also factors in when it comes to lupus and treatments and things like that, and how it impacts your life as a whole. I did want to touch on Cytoxan. It is dangerous, of course. We all know it's chemo, it's, poison. However, it was my miracle drug. It gave me the closest thing that I had to remission. I spent well over a year with, I'm not going to say no symptoms, because there were symptoms, but they were minimal. And I was able to return to the lab during that time, and I was able to work on a campaign and volunteer and do a million other things that otherwise I was not able to do previously, and I have not been able to do since. So you do need to weigh the pros and the cons when it comes to doing Cytoxan. Currently, my treatment plan includes tacrolimus and Cellcept and we all know the spiel and the long list of medicines that, Plaquenil, things like that, but it's not working. We've titrated and moved, dosages up and down, but in the next few days, I'll be seeing my rheumatologist again, and we are likely going to go back with Cytoxan with accompanying Rituxan. We're planning to treat aggressively again because my nephritis is being nephritis, and I'm also dealing with pericarditis as well as the pleuritis, and so that's been it's been fun. Lupus is a disease of many surprises, and I would say that if there was anything that could come of the design and the approval of medicines, if there was just something, number one, that came out that limited the number of drugs that we had to take, that would be great, but also something that improved the quality of life for patients, something that could give a mother the time with her children, that helps a student walk across the stage. Those things that, may seem small to everybody else, but they're huge to us. Like the lady said earlier, she can't open a can of corn. That's something that we all wish that, we take for granted with opening small things like that. And so if there was something that improved our quality of life, that would be the best gift.
Yeah. Well, thank you. And I think you're going to be able to help us understand what that might look like, because you said when you were on Cytoxan, you had a period of time where you had symptoms, but to you, it was essentially, you were able to do all of the things that were important to you. Mm-hmm. So can you describe during that period of time, what was the level kind of symptom burden that you had that would seem to be so manageable, but maybe to those of us that don't have experience with lupus, you can really kind of put that in context?
Yeah, absolutely. As I mentioned, during the time during and after I was on Cytoxan, I was able to do simple things, and that's, like I said, one of the most important things. I simultaneously held a full-time job, worked in a lab, volunteered for a campaign, as well as doing other volunteering around my neighborhood, and was a full-time student.
And which symptoms were being relieved? Was it the fatigue?
The fatigue, it was helpful with the fatigue, but somehow it did help with the joint pain. Now, I will say that I was on a very high dose of steroids at the time. I was getting steroids via IV, as well as taking pills at the time. We treated very aggressively because of how progressed and how active my disease was at the time. But I didn't experience the symptoms I was experiencing as far as the inflammation was concerned when it comes to the pericarditis and the pleuritis, and that is important. There's no feeling like laying in your bed and feeling like there is a 400-pound person sitting on your chest, and not having to deal with that, amazing.
Yeah. So which symptoms were you still experiencing then that you were able to deal, live through, so to speak, at that time?
So, as I said, it did help with the joint pain, but that was still there.
Still there.
There was inflammation. I would still get some swelling. And so those are things that I kind of could live with. Hair came out, and it's difficult to tell whether your hair is coming out from the Cytoxan or from the lupus. What I learned is that the hair that falls out from the Cytoxan, that hair grows back, and the hair that falls out from the lupus, it might grow back. With proper treatments, you'll have to get injections in your scalp and that whole thing.
Sure. Well, thank you for letting me probe a little bit.
Yeah,
that was very
absolutely.
insightful. All right, yep, we'll come right here and then work our way back.
Hi,
Trying my best.
Tracy Potts, Florida. I just wanted to piggyback on the Crohn's and lupus thing. A medication that hasn't been brought up because it's really for Crohn's is Remicade. And my doctor put me on that because the joint pain I was having, and they said that it might help. And I still have joint pain, and some days it's horrible, but it is much better on the Remicade, and I just wondered if anybody else had been on it, tried it, and found any benefits to it. I'm on that as well as Plaquenil, methotrexate,
Sure.
But I just wondered if that was something, anybody else that had any experience with.
Yeah, very interesting. Okay, if we can go straight back here.
My name is Kiana Alexander. I'm from the Bronx, New York, born and raised. And I have a few issues with lupus, like all of us. When I first got diagnosed about 7 years ago, it was more of the regular SLE and, the joint problems. I woke up to coordinate my dad's 60th birthday party, and I was, in the entertainment industry, event planner, and I get to the place, and I have on this big ball gown, and I'm setting up, and then I put my shoes on that I do conferences for like thousands of people, and I couldn't walk. So I'm like, what is going on? Later on, found out, there we go. Now first they told me I have rheumatoid arthritis. And I was like, I seen the commercials. I don't have rheumatoid arthritis. I don't know what you people are talking about. This is not it. So, of course, referral to a specialist, please, and took all the papers and the tests that they did, for me. Before in life, I, looked up my insurance and was like, oh yeah, I need a PCP real quick, because obviously something is wrong. I never got sick, active, everything. Then with that, I think about 2 years just went completely downhill. First time I was in the hospital 11 days, and I was like, oh, this is the longest I've ever been in the hospital. Little did I know. One day woke up, my mom was there, that was over the 11 days, and I know somebody has said before that they couldn't walk. I got up and was supposed to be going to the bathroom and stopped at the edge of my bed. My mom was like, what? What? I was like, I know I have to go to the bathroom, but I can't move. So between that, when she moved me, it was just pain, screaming. I didn't know what was going on. Stayed in the hospital maybe about 4 months. They still couldn't figure out what, was it. They didn't know if there was bone break, if a bone break, a bone split, anything. So from that whole process, therapy, et cetera, I was on, I guess, prednisone. I also have a G6PD deficiency, and I'm allergic to penicillin. So that was the long process because I couldn't take regular antibiotics because, just everything is counter. After that, I think I did the Benlysta for a little bit. And about a year or so, and it was working along with the prednisone and the Imurin. But then the Imurin started to have effects with the G6PD. So then everything stopped, and around then was when we were trying to figure out with the Benlysta, that was a lot of things with insurance issues too. You get caught in the middle, you make too much, you make too less, and even with charity and stuff, it was like, okay, $350 a month is definitely, right about now when you get lupus and everything, $2 a month extra is a lot. And then right about that time in 2006, I got in cerebritis. So then here we go again, a whole nother thing, and actually I'm going through a kind of a relapse flare now, and I just started Cytoxin again. And I guess what I really was saying about, mainly about the side effects and things, and people were talking about, wellness. And the first time I had the cerebritis, I was put in a therapy group. And when I was in the therapy group, I said, this should have been done the first time. Because, and especially now that I'm going through the same thing again, when you do that, when it's with the brain, it brings you back to the traumatic places that you were. And like now I feel like I'm going through these stages where I may or may not be abusing myself, because it brings you back to, then I'll lay here and then I'll be like, Kiana, you're not supposed to lay there. But nothing's wrong with my arm now. So I think it's important, that will be my issue, but everybody's issue, because everybody's going through a trauma, of some sort. So then, you might not be able to do anything about it physically, that's where the drugs help, or, may help. But, and, my advice is, like people say, your family, your help, and because the other issues you have to deal with,
It's good
on
to
your
know
own.
that is actually helpful, and I'm sure others might feel that other similar type therapy or working together with others, like you're saying, can really be impactful. So thank you. Yeah, this comment right here.
My name is Joann Quinn, and I'm from Long Island.
Joann.
I've been dealing with lupus for just about 50 years. And I've been through every treatment, the Cytoxin, tremendous amounts of prednisone through the years, many flares, lots of remissions. Been in the hospital more times than I'd like to count, and many of them being, we'll do the best for you that we can, which really is a positive way to look at it. And I guess what is bothering me here is I'm looking around at these many young faces, and I see myself 50 years ago. And we've been involved, my family and I, with lupus and lupus people all this time. And I guess what's really upsetting me is there's not much more to offer them today than there was to me 50 years ago when I was their age. And right now, I'm taking 15 prescriptions a day. The only one I'm taking for lupus is Plaquenil. I'm dealing with the side effects of the drugs for 50 years through my body. I was lucky, I had Cytoxin young, and I did have a son, and he's very healthy. He's 40 years old now, so we do have the family life that a lot of people have been denied. But I live with the guilt of my family having to deal with this for so many years, so many things that we couldn't do as a family because I just wasn't well enough, the plans that we couldn't make ahead of time. And I guess I'm really glad this is happening. I'm very excited that this is finally taking place, where all the lupus organizations are together and put together to do something positive. But I think if people who have the ability to change things for us, if they leave here, it's with anything that 54 years is ridiculous, and there should be more done.
Yeah.
Thank you.
Oh, thank you. I think your comments bring us to a good point for us to focus on what we need from future therapy, because 50 plus years is not acceptable, and we need things to help this community. So I want to turn to the question, of course, you and all of us would want a cure for lupus, but short of that, what is it that, if you have the mic, you can tell the drug developers, what is it that you specifically want from that next therapy or second or third therapy?
We know a cure is probably, it's not going to be in my lifetime. I'm hoping it's in these young people's lifetime. But to be able to live your life better, to be able to have not just hope, but the ability to plan ahead, the ability to look at tomorrow and say it may be better. And I kind of lost that a couple of years ago, that it's not going to get better. And to see this happen, I think we need to have hope. I think you need to be able to know that your treatment does not necessarily help you today and hurt you for a long time in your tomorrows.
Sure.
I mean, that's the most important part, to be have more hope in your treatment. I have great doctors, and I'm blessed. I know I'm blessed to be here this long. I know a lot of people along the way that we've worked with aren't. But it was a tough life, and I'm basically a positive person. But there are times when that dark tunnel got really long to find the light at the other end of it. And it shouldn't be. Not in this country, not with what's available in this country. It shouldn't be like that.
Sure. Thank you so much. So I know there's still, hands raised to talk about experiences with treatment, but if you could try to answer for us what it is you would like from future treatment, that would be really valuable. So, yep, we'll come here.
Hello. Hi, everyone. Good afternoon. You must be tired from sitting, especially if you have lupus. My back feels like it's breaking right now. I'm so tired. So let's see what I can remember with the lupus fog. So you asked what we'd like to see from future treatment, and I just want to address what I thought treatment was going to be like when I first got diagnosed 5 years ago. I felt really sick all the time. I didn't know I was sick. My mom finally dragged me to my PCP and said, "You're not being normal. Like, you're not sleeping. You're coughing up blood. Maybe you should go see a doctor." And they said, your life's not going to change. You just need a little bit of prednisone. It's this tiny little innocuous, innocent-looking thing, and you take it and you become a beach ball, and you can't walk, and you're disabled for 3 years, and you drop out of school, and you stop working. You're like, oh, all right, cool. Tiny little white pill is scary. After that, eventually, I was on Cytoxin, which led to an allergic reaction, which led to a stroke in my 20s. I was the youngest person in the ward. And what I would like to see out of treatment is treatment that improves the quality of your life on a day-to-day basis. The most important thing for my life is my relationships. When I had my stroke, I couldn't walk, I couldn't talk right, I couldn't eat, I couldn't chew my food, I couldn't use the restroom, I couldn't even lift my neck up. I had to have it propped with pillows for months. My mom and my mother-in-law spent a week at a time alternating taking care of me, feeding me, washing me, bathing me, helping me go to the restroom, helping me just sit up and trying to have small conversations with me so I could, regain the ability to speak. And to see those people around me have to suffer so much, to see my husband who's there with me day in and day out, to see him with me on prednisone yelling at him because I don't know what's going on. I'm just aggressive, I'm angry, I'm in pain. So really what I'm looking for in treatment is things that allow me to live my life. I know I may have organ damage, I know I may have this, I know my life expectancy may be this or that, but I want to be able to at least live, to function, to go to school, to work without having fear. The fear of hurting those around me and the fear of what my life is going to be like.
Sure. Thank you very much. We can go around the table here.
Thank you. Hi, I'm Camilla Gilliard, and I was diagnosed 19 years ago when I was 17. I'm 36 now. And what I would like to see with new treatments is I'm really tired of treatments that force us to make long-term decisions in a short period of time. We make these short-term decisions that have long-term implications, is what I'm trying to say. You could come down with a symptom today or an issue such as nephritis, and they're throwing Cytoxin at you and they're throwing pills at you, and it's like, okay, well, I don't want to die, I want to live, so if I want to live, I have to do this because this is all that's available to me as a lupus patient. And it's like, you make that decision to do that, but it's like, what about my fertility? What's going to happen? I don't have any children yet. Well, they tell you, well, you can't worry about that right now, you have to worry about yourself. Okay, but 10 years from now or 15 years from now when I'm childless and that's what I want, I'm going to be thinking about that decision that I made on the short term 15 years ago. So I'm hoping that they come out with treatments that don't make us have to give up the dreams that we have for a long term. I want a better quality of life that's going to last longer than the treatment or a side effect would last. Just in this past year, I've been through heart failure, pleurisy, migraines, sepsis, my kidney shut down. I've had 3 bouts of C. diff colitis. I have antiphospholipid syndrome, thrombocytopenia, anemia, lupus fog, hypoglycemia, psoriasis, pyelonephritis. I've had massive blood clots. All of this just in the past 12 months. And I've been through numerous therapies, and it's just like, there are alternative therapies, but those are not offered when these pills and these poisons are thrown at us. And I just wish that there could be some type of cohesiveness. Like when you're thrown prednisone, and we know what the side effects are when you're given this long term, and I've been on steroids for 12 years straight. Now I have osteoporosis, and I'm only 36. I've had my femur replaced with titanium. I'm looking at a hip replacement before I'm 40, and that's just not a great place to be. So if you know that these drugs are dangerous and they have these side effects, why are we not telling people from the jump, you should be on B12 therapy, you should be taking calcium supplements, you should be going to any type of Eastern traditional medicine. There are other things that could be done at the same time while you're taking pills. So I just wish that things would be more cohesive.
Sure. There's a comment in the back. If we could get a mic right there, and then we'll come back up here.
Hello, my name is Leslie Wilson. I'm from Cleveland Heights, Ohio. And I was diagnosed with lupus over 31 years ago. So I can identify with all the stories, in the room. But the one thing in particular that I wanted to share was when I was a student at The Ohio State University, and I was taking Cytoxan, I was given a drug to block my ovaries to prevent ovarian failure and infertility. And I'm not sure if anybody has heard of that drug or knows the name of that drug. I don't remember, but that was something that I was given, and I do have, since that time I had 2 children, a 22-year-old and a 19-year-old, and they're doing well. But with each pregnancy, 8 months after each pregnancy, I had acute kidney failure. I suffer from lupus nephritis, and I had a kidney transplant about 10 years ago. But specifically, I'm concerned about that specific drug that I received at Ohio State. I'm not sure if anybody has had that or knows the name of that.
Okay. All right, if we can, we have a few more minutes, so we can take a couple more comments about what we're looking for from future treatment. Yep.
Hi, my name is Elizabeth Iglesias, and I want new drugs for lupus. In 1981, I walked into a urgent care facility. I was limping, didn't know what was wrong, and a woman doctor, probably just got out of medical school, said, I don't want to worry you, but I think you might have lupus. And I got scared, and she was dead right on. She gave me Clinarol, sent me to a rheumatologist who put me on Bufferin, and so began my lupus journey 36 years ago. But I can trace it 10 years before that, when I had mononucleosis and skin rashes and many other things happen. Over the years, the rashes, the inflammation, I went to school to become a nurse practitioner and had my school and my career interrupted and cut short. I became disabled in 2001. And I too am on Plaquenil. And I was on diclofenac. I've since stopped that because I have kidney involvement, like many of you. I have been on steroids. And as a result of steroid treatment, I had a double cataract eye surgery when I was 50 years old. I'm now 54, living with lupus. I have to stop because I have been very touched because you all are my lupus community. You are my family. We are a family here. When I listen to the panelists, all these words that you've spoken, all these words that are less than, where you feel old or you feel like you've let your family and friends down, you feel less than. I've been there, I felt that. All these things are what we all feel. And that's been my journey too. So I want to let you know that this has been very, very emotional for me and very touching for me. And I appreciate you all bearing your hearts and souls today, and I want to thank you from the bottom of my heart. I had to interject that because it was very important for me.
Is there anything you can say about what it is you would like
Yes,
from a future treatment?
Let me get back on board with that. I've been experiencing hair loss as a result of them lowering my Plaquenil, and then they upped it again, and it still didn't work. So I decided to cut some of my hair off until my hair stopped falling out, and deciding to take steps to tell your body to stop doing things. Finally, my body's trying to my hair's not falling out as much. The steroids have wreaked havoc on my vessels in my legs. I've now developed peripheral vascular disease. I've had several instances where I've had rashes as a result of walking for extended periods, much when we've done some advocacy work, when we've come down to Washington. But I've tried some things. I'm very encouraged about this clinical trial that they have with fish oil. I've been taking fish oil because they say that that's going to be great. I can't take diclofenac anymore. I can't take NSAIDs anymore for pain, and I have pain. I can only take Tylenol, so I'm encouraged about that. I'm looking forward to that. I want a drug, and I want treatment that is not going to affect every organ of my body. I want them to develop something that is going to take lupus and not have to have it affect every organ of my body. Let's get it so that it only affects a limited amount of things. That's what I want to see it happen. Like, let's cut down on the amount of things that it affects. That would be a great thing. FDA, you're here. You're listening. Let's do something about this. We really want new things happening. We need it.
Any final thoughts for us? Or I thought it was useful talking about not having, cutting down the scope of what lupus affects and not the totality of the body. And we have only about 1 more minute left, so I want to try to get one more comment in. Thank you very much. We can go to the final comment right here. Well, we'll do 2 comments. If we can do 2 quick comments, one right behind her. Whoop, go ahead. You're good. And then right there.
Great. Hi, my name is Cherie Perron, and I'm from Philadelphia. Several people today have talked about remission. I don't know what remission is. I was diagnosed with lupus in 1994, and lupus nephritis in 2001. I've been through Cytoxan a few times, few years apart. Rituximab almost killed me. It was a very, very dangerous drug for me, and I cannot take that. Had an allergic reaction to Imiran, another drug that was very, very dangerous for me. I would like to see drugs. We know that the drugs are going to have side effects, but we'd really like to see drugs with less severe side effects. The other thing about the side effects is the side effects are different for each person. I have been on various doses of steroids for the last 3 years. The thing with the steroids for me personally is high doses of steroids causes GI issues, acid reflux, gastritis. So I have to have pills to offset that. But because I can't eat, I lose weight. When I lose weight, I have to have, Ensure 3 times a day just to maintain my weight. So the side effects are different for each person. I would really like to see drugs with less severe side effects.
Sure. Yeah, thank you. It's definitely something different than we've heard so far. And our final comment?
Hi, I'm Mary Jo Hauser. I live in Connecticut. I've been living with lupus for 40 years, and I have a myriad of symptoms that most of you have talked about. I do have systemic lupus, so it's affected my kidneys and my heart. And I didn't hear a lot of people talk about the heart today, but the heart is a significant factor in my life and really has created the most stress and the most surprises. And I've been through prednisone and ended up with 2 hip replacements and couldn't take it anymore. Was on Cytoxan and was on Plaquenil for 15 years, and they took me off it just recently because of the heart issues that I was having. And I want to say that I think that, you know, it's very nice to address the symptoms in prescriptions, but I think we need to address the cause. Because lupus, even after, and they say I'm in remission now, I'm on the kidney transplant list, and I'm waiting for a kidney transplant. And if the problem is that even though the flares are not there, the kidney is still scarring, and it's still destroying the kidneys. And so that's where our focus needs to be, on the really important systemic issues of lupus that, you know, people look at me and they say, you don't look sick. And like so many people have said here today. Well, you know, I am one of the sickest people you've ever seen. And so I would say to the prescription drug people, find something that addresses and stops the systemic piece so that we can live normal lives.
Thank you very much. And you guys are